Good morning.
Morning.
My name is Yapson. I will be your nurse practitioner today. Can you tell me your name?
Frank.
Frank. What can I do for you today, Frank?
I'm here for my physical exam.
Excellent. Frank, do you have a consent to your physical exam today?
Yes.
Excellent. All right, then. So I'm going to wash my hand and then provide some privacy for you. And then I'm going to take your vital sign. That's okay?
Okay.
All right, then. Frank, do you have any pen today?
No.
All right. So what day is today?
August 8th, 2025.
Excellent. And then how you get here? Somebody drive you here or you drove to here?
I drove
Excellent, excellent. Can you tell me where are you right now?
in the clinical.
In the clinic. Perfect, excellent. All right, and you still have any pain, and you draw patient is alert oriented, and after asking questions, patient's speech is intact. There is no sign of dysphagia, there is no aphasia. Patients appear to be in no distress. Um, no sign of distress. Skin is normal, age appropriate appearance. Um, Patient is very pleasant. Okay, during the physical exam, I'm going to assess the skin, and then if I find any abnormality, I'm going to use my ABCD, okay, to assess for severity, and then possible consultation for pathology. Okay.
Okay.
Frank, I'm going to start by looking at your head. Okay, head is normal cephalic. I don't see any abnormality. I don't see any lesion, any mass. And I'm going to start looking at your scalp. If you feel any tenderness, you tell me, okay? Do you feel any tenderness?
No.
Okay. Any pain?
No.
Excellent. All right. Hair is well distributed. There is no sign of alopecia. There is no lysis. All right, Frank. We're going to look at me in my eyes. Okay. Face is symmetrical. There is no sign of abnormality. Patient seem well hydrated. There is no lesion and there is no mass. There is no sign of any unilateral drunkenness. Age is appropriate. Okay, Frank, I'm going to start by assessing your sensation in your face, and I'm going to touch your face. If you're going to tell me if you feel dull or if you feel sharp. Okay,
Okay.
sharp or dull.
No. No. No.
Close your eyes.
No. No. No.
Do you feel the same both sides?
Yes.
Excellent. Tell me what you feel.
Sharp. 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 Sharp.
And you feel the same both sides?
Yes.
Excellent, Frank. Good job. Now, Frank, I'm going to, after assessing the patient sensation, cranial nerve 5 is intact, and I'm going to look at your nose, Frank. Is that okay?
Okay.
Alright, so I can look at the nose. Both nostril is symmetrical. There is no sign of deviation. There is no mass, and there is no wetness, and no external drainage. Frank, I'm going to close one of your nose, and I'm going to shine a light on your nose. Okay?
Okay.
I can see the internal nostril. There is no lesion. Nasal mucosa is normal. Hair well distributed. No masses. Look on the other side. Okay. As this side, I can see hair well distributed. Nasal mucosa is normal. I can see turbinate. Normal. Excellent. Alright, Frank, at this point, I'm going to give you something to smell. You tell me what you smell, okay?
Okay.
Alright. What do you smell?
Vanilla. Vanilla.
Excellent. Good job. Thank you. Alright, Frank. Now, I'm going to assess your sinuses. I'm going to press over your superior orbital area, and you tell me if you feel any tenderness or if you feel any pain, okay?
Okay.
Do you feel any tenderness?
No.
Excellent. Now I'm going to assess your maxillary sinuses. Any tenderness?
No.
Any pain?
No.
Perfect. All right. Now I'm going to ask you right now to open your eyes for me. All right. Close it tight. Can you pop your tongue like a balloon? All right. Cranial nerve 7 is intact. All right, Frank, now I'm going to assess your eyes. I can see the eyelids. They look normal. There is no nodules and no edema. Um, no erythema. Looking excellent. Eyelashes, hair well distributed. No edema, no erythema. Okay. I'm going to assess your conjunctiva. I'm pressing down in the inferior orbital area, right looking. Blood pressure is okay. There is no abnormality. Okay, normal blood vessel, and the same way for these eyes. Okay, I can see the sclera. There is no soft hemorrhage. Normal blood vessel. Excellent. Now, Frank, I'm going to ask you to move your eyes left, right, without moving your hair. All right. The cardinal 6 gauge is intact. Now I'm going to ask you to follow my finger for me. Up, down. Okay, patient eyes is parallel, normal accommodation, no sign of nystagmus. Cranial nerve 3, 4, and 6 are intact. Excellent. Now I'm going to ask you, Frank, to open your mouth for me. I'm going to access for DMG. Open and close. Move your mouth left and right. Alright. Alright, DMG is normal. Range of motion. Excellent. Good job so far, Frank. Alright. So now I'm going to assess your mouth, okay? So I can see the internal lips are normal. There is no sign of a lesion. There is no edema. There is no face drunkenness, unilaterally. Everything looking normal. Okay. Can you open your mouth for me, Frank?
Yeah.
Okay. I can see there is no missing teeth. I can see the buccal is normal. There is no lesion. There is no abnormality. The heart platelets is intact. Can you move your tongue and the other side for me, Frank? Perfect. The other side. Perfect. Okay, I can see the epiglottis and then the larynx is okay. I'm going to activate your gut reflex, okay? Okay. All right. Thank you so much. Cranial nerve 12 and 9 are intact, okay? Frank, now I'm going to assess your eyes. I'm going to shine a light in your eyes, but for me to do that, I'm going to ask you to cover your eyes with this one for me, okay? Cover this one, okay? All right, I'm looking at the left eyes. I can see the red reflex. Optics is can be seen. Open your eyes, Frank. There is no hemorrhage, normal blood vessel. I can see the mercury and landmark normal. Okay, do the other side for me, Frank. Okay, I can see the optics is intact. No hemorrhage, normal blood vessel. Can see the mercury. Perfect, excellent. All right, Frank, I'm going to ask you to keep your one eye covered. Cover one eyes, and you're going to read the line 8 for me.
Okay. D E F B O D E C.
Perfect, and do the same thing for the other eye.
D E F B O D E C.
Excellent. Patient has a night vision. Up this yeah. Cranial nerve 2 is intact. Alright, Frank. Now I'm going to assess your ear. I can see the external area of the ear. There is no drainage on it. There is no redness. Pinna is normal. Um, there is no lesion. So everything looking nice. Now I'm going to Frank assess the internal ear. Okay, I'm going to shine the light. I'm going to pull it up and back. Okay, I can see there is no drainage. I can see the bony landmark, tympanic membrane, gray looking color. There is no lesion, ARX, normal. Okay, the same thing for this side is fine. I'm going to pull it up and back. No drainage, no rhythma, bony landmark is present. Tympanic membrane is gray looking color. Excellent. Everything okay so far, Frank?
Yes.
Excellent. All right. But I'm going to whisper a number, okay? And I'm going to say 2 feet to away, and you tell me the number, okay? 33.
33.
Okay, I'm going to the other side and whisper one more number for you. 44.
44.
Excellent. Perfect. Now, Frank, I'm going to assess your lymph node. Okay, I'm going to start looking at your preocular. Any tenderness?
No.
Postocular? Any tenderness?
No.
Okay. Now the mandibular? Any tenderness?
No.
Alright, submandibular, no tenderness. Alright, excellent. Alright, now Frank, I'm going to assess your neck right now, okay?
Okay.
Looking at, can you lift up your head for me? Okay. Trachea is midline. There is no sign of deviation. There is no bump, no arrhythmia. I don't see any masses. Okay, Frank, I'm going now to palpate your neck. Is that okay?
Okay.
Okay. Okay. Perfect. Perfect. All right, Frank, I'm going to listen to your carotid artery for any bruise. With both my belt and the diaphragm. Can you look at that side for me? Okay. Excellent. Can you swallow for me? Perfect. Excellent. There is no bruise. Okay. I don't feel any mass. That is normal. There is no sign of goiter. Perfect. Excellent. Okay, Frank. Now I'm going to assess your thorax, your anterior area. Okay, and I'm going to. I can see there is no asymmetry. Everything looking symmetrical. There is no mass. There is no hips. There is no sort of lesion. There is no scar. Looking fine. Excellent. I'm going to palpate your stomach and your chest. You tell me if you feel like any tenderness, and then you tell me a number, okay? Until I ask you to stop, okay? 99.
99. 99. 99. 99. 99. 99.
Perfect. Excellent. And I'm going to listen to your lungs, okay? Whenever you feel the stethoscope in your chest, you take a deep breath, release it, and I'm going to do that for both my belt and the diaphragm. Excellent. Perfect. All right, Frank. Now I'm going to assess your back. Okay.
Okay.
Okay. I can look at the back. There is a symmetrical. There is no mass. There is no lesion. Um, I'm going to ask you, Frank, to say 99 for me.
99, 99,
Uh-huh.
99,
Uh-huh.
99.
Excellent. So CVA is negative. I'm going to listen to your back and you tell me, you take it not deep breath from me, okay?
Okay.
Mm-hmm. 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 Excellent. Now, Frank, I'm going to listen to your heart and I'm going to listen to the aortic valve in the right second intercostal with my both bell and diaphragm. Excellent. Excellent. I'm going to listen to the pulmonic valve in the left second intercostal, my both bell and diaphragm. And I'm going to listen to the herb in the left third intercostal. Tricuspid in the left fourth intercostal. And the PMI, mid-clavicular. I'm going to palpate first, my tip of my finger, my belt. Excellent. All right. All right, friend. I'm going to ask you to lay on your head in this pillow for me. I will make sure you have your head at 35 to 45 degree. Frank, before you come to the clinic, do you use the bathroom?
Yes.
Excellent. So while you're on the bed, I'm going to assess your GVD while you're headed in 45 degree, and I'm going to measure the angle, the external angle area. Excellent. And that is approximately 2 to 3 centimeter as expected. Perfect. Looking at the patient skin and the abdomen, I don't see any pulsation. I don't see any mass, no lesion. So it looks symmetrical. Um, and I'm going to start by auscultating the aortic artery and the abdomen. Okay, left renal artery, right renal artery, and I'm going to assess the abdomen to see right upper quadrant, okay, left upper, left lower, right lower. Excellent. Normal ABD sound. Excellent, friend. Now I'm going to palpate your abdomen lightly. Any tenderness?
No.
No tenderness? Any pain?
No.
Excellent. Now after I'm going to palpate your abdomen cut more deeper, okay? I'm going to palpate your kidney. Right kidney, not felt. Left kidney, not felt. I'm in the left side, I'm trying to see I can palpate the liver. I mean, not the spleen. No spleen. And the right side, not the liver. Not palpable. Alright, excellent. Alright, Frank, so I'm going to ask you, Frank, if you can please go sit in this chair for me. Alright, everything okay so far?
Yes.
Alright. Alright, Frank, I'm going to assess your sensation in the arm. Okay, you close your eyes. You tell me if you feel sharp or if you feel dull. Okay? Sharp or dull?
No. 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 No.
Excellent. And you feel the same both sides?
Yes.
Okay, Frank. Now you tell me, do you feel sharp or dull?
Sharp. 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 Sharp.
Excellent. And you feel the same sensation both sides?
Yes.
Excellent. All right, Frank. At this point, I'm going to ask you to extend your arm for me. Perfect. Put behind your back. Excellent. Can you move your hand like in your shoulder? Perfect. Okay. Can you move your hand forward for me? Like that? Excellent. Can you flip it like that? Perfect. Excellent. No more range of motion. I'm going to assess your skin turgor. Patient seems to be well hydrated. Alright. Well hydrated, no self dehydration. No more capillary refill. Okay. But I'm going to assess your reflex in your arm, your hand. Alright, and the other one. Alright, there's no more reflex. Alright, Frank, I'm going to assess your pulse now, okay? Alright, break your pulse 2 plus, with your pulse also 2 plus, okay? And I'm going to assess your bicep, okay? No more reflex, no more reflex. A tricep, alright, plus 2, plus 2. Excellent. Alright, Frank, I'm going to assess the sensation in your leg, okay? You close your eyes and you tell me what you feel. Sharp or dull?
Dull. 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 Dull.
Excellent. And you feel the same both sides?
Yes.
Alright. Now you feel sharp or dull?
Sharp. 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 Sharp.
And the same both sides, Frank?
Yes.
Excellent. Thank you so much. Alright. Frank, I'm going to ask you to move your shoulder up. Cranial nerve 11 is intact. Okay? So now I'm going to assess your pulse. Okay? Your femoral pulse. Plus 2. Your pupil pulse. Plus 2. Pedis pudalis. Plus 2. Alright, can you move my hand up? Move your knee. Stronger, stronger. Excellent. Can do the same thing in your feet. Perfect. Excellent. I'm going to assess your patellar reflex. Okay, no more reflex. Okay, patient toe did not move outward. That means Babinski's test is negative. Okay, Frank, I'm going to please ask you to move your finger for me. Move your finger up, down, okay, side, excellent, inward, excellent, perfect. Now, Frank, can you stand for me? Okay, I'm going to ask you, Frank, can you close your eyes? Put your eyes closed and your feet closed. Alrighty. Okay, patient has a good balance. There is no strain. Okay, lumbar test is negative. And I'm going to ask you to walk to the wall for me. Excellent. Patient has a good balance. Can go back. Perfect. Now, Frank, can you walk and you're here? Like that? Perfect. Okay, Frank, you can come back and sit down. All right, Frank. Do you have any question for me, Frank?
No.
All right. Well, so that is the end of the physical exam. It was a pleasure meeting you. Okay. Until next time. Okay. Bye. Bye.